We're extremely active. Anytime we can be outside, we're outside, playing basketball, swimming, football, cheer. And oftentimes in those moments, I think about what it would be like to have our extra player. I haven't gone through this in a long time.
No, we haven't.
You know, when we were starting to talk about having our children, you wonder when's the right time. And never in a million years did I think that I was not gonna be able to have a child when I wanted one. And so we went through 6 rounds of IUI and 2 rounds of IVF. And on the second round of IVF, found out that we were gonna have 2 boys, our twins, and we went all out. We got 2 of everything. The nursery was decked out. The gender reveal was one of my happiest memories of being pregnant. And there were a lot of intentional things that I did to make sure I had a healthy pregnancy. I went for a routine ultrasound. I was about 6 months along at that point and was told right away that I was in preterm labor. And so got admitted immediately and felt all the things that our patients feel. Helpless, hopeless. We were prepared to not have either boy. I just remember being consistently in prayer because that's all we could do at the time was to hope and pray. And so we were blessed to get to Medical City, Louisville, where I was on bed rest for 4 weeks. And at around 29 weeks, we went in for an emergency section, and Ash and Hudson were born in the middle of the night.
Immediately I was like, wow, they are really, really small. One weighed, Asher weighed 2.5 pounds and Hudson weighed about 2 pounds, 6 ounces.
They were little, fragile, both were intubated, and you could tell Ash had a tenacity and a fight in him, and Hudson was just trying to make it. So it was 2 different journeys for both of our boys, very different.
The staff was amazing.
Out of all the nurses, we had a favorite, and that's Jenny. And we would request her over and over again. We came into the NICU one evening and Hudson was struggling and it was visible, and we knew that he probably wasn't gonna make it. He had to be revived a few times that day. And so they took us into a room with Hudson and Jenny was there. And it was the first time that I got to hold my son. In the last time. Brain bleeds aren't completely uncommon in premature babies, and we were aware of the risk, all the things that the NICU team prepared us for, and all the things that they tried to prevent and make sure that he lived a healthy life. And I think that's why we want to speak up and share our story.
There is a lot of stories like ours. It is our opportunity to turn this into a positive aspect of our life.
Medical City did so much for our boys and did so much for our family, and the March of Dimes, with their advocacy, we know that medicine can continue to advance. There's so much more that the industry can do, that technology can do to give the Hudson back to another family. And we also want every parent to get to bring their whole team home.